What if a vaccine you might already have, or maybe should be considering, offered protection for more than just one serious health concern?
Hmm.
Well, the intriguing question we're diving into today. We're exploring a potential connection between the shingles vaccine and a reduced risk of developing dementia.
Yeah, it's pretty fascinating stuff. We've got a new study just out in Nature and some expert commentary to sort of walk us through it.
Right. So our mission to unpack this link and understand what it could really mean for, your long-term brain health.
What's fascinating here is how research keeps revealing these, well, unexpected connections within the body.
Mm-hmm.
We often think of health issues in isolation, right?
Mm-hmm.
But findings like this really underscore the intricate ways our systems interact.
Okay, let's get straight to the core of it then. This new study found that shingles vaccination was linked to a significant 20% reduction in the risk of developing dementia. In older adults, over a 7-year period, that's not just a small difference. For you listening, it could translate into a notably lower likelihood of facing this challenging condition later in life just by getting a vaccine that protects against, well, a pretty painful illness.
Absolutely. A 20% reduction over that time frame is, as the lead researcher, Dr. Pascal Geldsetzer of Stanford put it, a very robust finding.
Yeah.
And what's particularly noteworthy for you is that the study suggested women appeared to benefit even more.
Oh, interesting.
Yeah, considering women face a higher lifetime risk of dementia, this potential added layer of protection is, well, potentially incredibly valuable.
Now, for anyone who hasn't had a run-in with it, what exactly is shingles? It sounds like something you definitely want to avoid.
You're right. Shingles is a painful condition. You get this rash, blister-like sores, usually just on one side of the body.
Ouch.
Yeah, and it's caused by the varicella-zoster virus, the very same virus that causes chickenpox.
Ah,
So if you've had chickenpox, and, most people born before 1980 have, this virus just lies dormant in your nerve tissues.
hmm.
Shingles happens when your immune system weakens a bit, allowing the virus to reactivate.
And from what I've heard, it's not just a minor inconvenience. People describe it as incredibly painful.
Oh, it can be severely debilitating. Seriously. Beyond the initial pain and rash, shingles can lead to serious long-term issues.
Like what?
Well, one of the most common is postherpetic neuralgia, that's severe nerve pain that can just persist for months or even years after the rash disappears.
Wow.
And if shingles affects the eye, it can even cause vision loss. So given that the CDC estimates about 1 in 3 Americans will experience shingles sometime in their life.
1 in 3. That's high.
It is. It's a significant health concern in its own right. Absolutely.
So, okay, we know shingles is bad news, something to avoid. But how does this relate to dementia? Seems like a totally different health challenge. What's the potential connection between this shingles virus and our brain health?
This is a really important question, and it's something researchers are actively exploring. There's this growing understanding that viruses, particularly herpes viruses like varicella-zoster, might play a role in developing dementia, alongside genetics and other risk factors we know about.
How sad.
Well, one key mechanism appears to be inflammation. The reactivation of the shingles virus can trigger inflammation throughout the body, and we know that chronic inflammation can be detrimental to the brain. It could potentially accelerate the processes that lead to cognitive decline.
That makes sense. We often hear about the negative impacts of inflammation on overall health.
Exactly. But the link might even be more direct. Dr. Maria Nagel at the University of Colorado Anschutz Medical Campus has found the virus can actually infect blood vessels within the brain.
Whoa, really?
Yeah. This could contribute to forming blood clots, reducing blood flow. Both are risk factors not only for stroke, but also for dementia. And what's particularly fascinating, her lab also discovered that shingles can encourage the formation of amyloid protein, those sticky deposits in the brain that are, a hallmark of Alzheimer's disease.
Wow, that's a much more direct connection than I would have guessed. So it's not just an indirect effect of feeling unwell. The virus itself might be actively contributing to the biological processes tied to dementia.
Precisely. And this kind of builds on earlier research, too. You might remember a study from last year suggesting that even just having an episode of shingles could increase someone's risk of developing dementia by about 20%.
Right, I think I recall that.
So the idea that this virus could be implicated in cognitive decline, it's been gaining traction.
Okay, this brings us back to this new study in Nature. How did Dr. Geldsetzer and his team arrive at this 20% reduction figure? Who were the people they studied, and how did they design the research?
Well, what's really clever about this study is its design. They focused on older adults in Wales around age 80, back when the first generation shingles vaccine, Zostavax, was introduced over a decade ago.
Mm.
Dr. Geldsetzer used what's called a natural experiment. When the vaccine was rolled out there was this specific age cutoff. People aged 80 or older on September 1st, 2013 weren't eligible for the vaccine, while those who were still 79 could get it.
Ah, I see the ingenuity there. So you have two very similar groups of people, those who just barely qualified for the vaccine and those who just missed out. That's a really smart way to study the potential effects.
Exactly. By comparing these two groups, people who were very close in age, likely had similar overall health, the researchers could essentially mimic a more controlled clinical trial, where people are randomly assigned the vaccine or a placebo.
Right.
They analyzed the medical records of over 280,000 individuals to see if there was a difference in dementia rates between the vaccinated and unvaccinated groups over the next 7 years.
And that's where the 20% came from.
That's where they found this significant 20% reduction in dementia risk associated with getting the shingles vaccine. It's like the researchers found this real-world scenario that let them see the vaccine's impact almost in a controlled setting. That gives us a lot more confidence in these findings for you, the listener.
Now, it's important to remember the vaccine used in this study was the first generation, Zostavax. What about the vaccine that's currently recommended here in the U.S., Shingrix? Does this research tell us anything about that one?
This is the crucial next question for you, definitely. While this study focused on Zostavax, which we know is less effective at actually preventing shingles than Shingrix.
Right, Shingrix is a better one now.
It is. But the findings are certainly encouraging. As Dr. Nagel emphasized, a critical next step is to figure out if Shingrix also offers this protective benefit against dementia. And importantly for you, the vaccine most commonly recommended now is Shingrix.
Okay.
And while this study looked at the older version, there is some promising early research from another group suggesting Shingrix might indeed be beneficial in this way too.
That's definitely good news. So this isn't just about an older vaccine that's not widely used anymore. There's hope that the current standard of care might also offer this valuable added benefit.
Absolutely. And the research is ongoing. The manufacturer of Shingrix, GSK, actually just announced a collaboration with UK health authorities specifically to track the cognitive health of seniors who get the Shingrix vaccine.
Oh, good.
Yeah, and Dr. Geldsetzer also plans to continue his research, looking into whether the specific type of shingles vaccine makes a difference in dementia risk. So we should have more answers on this important question in the coming years.
Given this potential link, it really makes you think about the current recommendations for the shingles vaccine, doesn't it? Who should be getting it, and what's the current rate of vaccination?
Yeah, well, the CDC currently recommends the Shingrix vaccine for most adults starting at age 50.
50, okay.
It's given as a 2-dose series, usually 2 to 6 months apart. Importantly, it's also recommended for younger adults with certain conditions that weaken their immune system and for people who previously got the older Zostavax vaccine.
Right.
However, despite these clear recommendations and now this potential added benefit for, your brain health, the vaccination rates are surprisingly low. Fewer than 40% of eligible adults in the U.S. have actually been vaccinated against shingles.
40%, that does seem like a significant gap.
It really is. It makes you wonder if more people knew about this potential added benefit for brain health, would those numbers be different for you and others?
Are there common reasons why people might not be getting the vaccine? Any hurdles?
Well, some individuals might have concerns about potential side effects. These can include temporary reactions, like soreness at the injection site, and maybe some flu-like symptoms, fever, muscle aches. And the CDC does advise that if you're currently sick with another virus, like the flu or COVID-19, it's generally best to wait until you've fully recovered before getting the shingles shot.
Okay, that makes sense.
But, for the vast majority of people, the potential benefits preventing shingles and possibly reducing dementia risk likely outweigh these temporary and generally mild side effects.
It truly does put a new perspective on the decision to get vaccinated, doesn't it? It's not solely about avoiding the often severe discomfort of shingles itself,
Right.
but also about potentially safeguarding your long-term cognitive well-being.
Exactly. As Dr. Anupam Jena, who's a physician and health economist at Harvard, pointed out in his commentary in Nature, considering the increasing prevalence of dementia in aging populations, any potential preventative measure is incredibly significant.
Yeah.
This study offers another compelling reason for you to consider vaccination, going beyond just preventing the painful and sometimes debilitating effects of shingles.
So while we wait for more research, especially on Shingrix, what's the key takeaway for you listening to this? And are there other established steps people can take to support their brain health as they age?
Yeah, the main takeaway for you is this. New research suggests that getting the shingles vaccine may offer a valuable and maybe unexpected layer of protection against dementia. It's an important piece of information to consider when making decisions about your health.
Okay.
And this research really underscores the ongoing need for more investigation, especially focusing on the currently recommended Shingrix vaccine. But of course, it's also vital to remember the well-established ways to reduce your risk of dementia.
Right, the lifestyle stuff.
Exactly. Staying socially and mentally active, managing conditions like high blood pressure, high blood sugar, especially if you have diabetes, all these things contribute significantly to maintaining good brain health as you age.
This has certainly given me a lot to think about. Knowing this potential link, does it change how you view the shingles vaccine for yourself or, your loved ones?
Hmm.
And what other seemingly unrelated health choices might have surprising long-term benefits for your brain? It really makes you consider the interconnectedness of our health
It really does.
and the potential ripple effects of our decisions. Thanks for taking this deep dive with us today.